Hi, we're here today with Dr. Dale Patterson, Vice President of Medical Affairs at Memorial Hospital. Dr. Patterson, thanks for joining us today.
Hi, glad to be here.
So it was mid-March when we at Beacon instituted some restrictions, visitor restrictions for the safety of our patients, the community. Today, though, we're at a point where we're able to ease up on those restrictions a little bit. What changes went into place today?
Yeah, we're very happy to announce that we have been able to relax some of our visitor restrictions. It's hard to believe it's been 3 months, and we appreciate the patience of our patients and their family members. And we know it's been a burden for them not to be able to come to the hospital when we have patients here that would like to have visitors. Today, we started a new policy where we're going to, for most patients, allow 2 visitors, and they do have to be 18 years of age or older. They have to be well, not sick, and they will have to wear a mask the entire time that they're in the facility. But we are happy to announce that you'll be able to come and see your family and friends while they're in the hospital on that limited basis.
That is such great news for so many people. What can you expect as a visitor when you arrive at the door?
And when you show up at any of our facilities, you're going to have to answer some questions to reassure everyone so that we can keep people safe within our facility. We want to keep our patients, most importantly, safe. We also want to keep our associates safe and our visitors safe. So we don't want people coming in who may be actively infected with COVID and spreading that within the facility. So there's a screening questionnaire that we'll be asked to complete. And if all those questions are answered appropriately, we are no longer going to take temperatures at the door, but we will screen with the questions, and then the visitors will be allowed to enter as long as they have a mask on. So we're going to try to do everything we can to keep this process efficient so that people don't have to stand in line and wait to get into the hospital. But at our busiest times, you may find that you have to wait a few minutes to get in. Please be patient and observe social distancing and keep each other safe while we're doing that.
Still many safeguards in place. And along those lines, what are we still advising for high-risk visitors?
Some people who would want to visit the hospital really should think twice before they come. And we're really talking about people who are over age 60 or have complicating medical illnesses that put them at high risk for complications from COVID. We aren't going to tell those people they can't come to the hospital. It is up to them, but they should think twice about coming when they could potentially be exposed. These are the people that we also recommend are staying home and not going out as much to protect themselves from the complications if they were to get the illness. But we will allow people to come in to see their families. We just want them to be cautious and understand that there are risks with being out and coming into a situation where you might be exposed to the virus at this point.
We aren't out of the woods yet, right?
We're definitely not out of the woods. We think we have a little bit better understanding of where we were 3 months ago, and it's amazing how much things have changed. And we're really happy to be able to let some people back into the hospital to visit. We know it will be good for our patients and it will be good for the families, but we want to do it safely. And we ask that everyone follow the rules and the guidelines that we've set, and we will make it as safe as possible for everyone.
Thanks for joining us today and for offering your insight and such great news that we're going to be able to allow more people in again.
You're welcome.